does one assess that they are truly being treated in the correct manner? Are hands-on adjustments appropriate? Do you put hands on patients, or is it all about training, exercises, using perhaps weights? Just tell us how we can approach pelvic floor therapy and ensure that our patients stay safe.
Yeah, so it's interesting. I would say in pelvic floor therapy, it's in my experience, or at least what's been reported, it's not a particular specialty where we see a lot of abuse. I think more often people are coming to us who have experienced trauma, whether within their medical field, through other physicians, or even within their life, sexual trauma, emotional trauma. I don't think that the abuse is necessarily happening within the clinics. I think it's often happening in life and community. And medical trauma is a form of trauma, being gaslit, dealing with chronic issues, suffering day to day, and not knowing where to get help. By the time people come see us, I think they often feel relieved that there's hope. So, and it's also, again, this is another part of the body. We carry so much shame about this part of our body. We've been told it's dirty, it's smelly, it's only for sex. And that's just not the case. And I think that education comes with normalizing the conversations around this part of our body, desexualizing it, and bringing awareness to not just people in the community, but even the medical profession about the need to address these issues. When it comes more specifically about what to expect in a pelvic physical therapy assessment, the way that we assess these muscles is actually through a vaginal assessment. So these muscles, it's a basket of muscles, but through the vagina or through the anal opening, which is often, if you're a male body, kind of how we assess the muscles, is picking a glove lubricated finger, the patient's lying down, they're undressed from the waist down, covered by a sheet or a gown, and we do a vaginal assessment of the muscles. Now, the number one thing is that you have the right to say no. Consent is important always, whether it's touching on the outside, doing a pelvic assessment internally, having another person in the room, having anyone there that it help make you feel more comfortable. And it also doesn't have to be right away, but how we do assessments is internally, vaginally. The other thing is that you have to feel comfortable. And I tell people this, I have 2 kids and I'm constantly telling them, trust your intuition, listen to your inner voice. We as females, as humans, as vagina owners need to do the same thing. If something doesn't feel safe, it's not safe. And oftentimes after the fact, we don't realize that. And then we're like, oh my gosh, something's happened. And then, yes, that is abuse, whether it's physical, emotional, whatever. But I would say it is a hands-on approach. It's also exercise-based. So it's a combination of those 2 things in this type of therapy.